This is Post-COVID-19 Symptoms, the 100 Most Common by Gary Ordog, MD. This video will start with the most common 15, and subsequent videos will have the 30, the 50, and the 100 most common symptoms. This study was first published on ResearchGate in 2020 and in Academia by Gary Ordog, MD. It is available on those two websites to view the whole article, as this is just basically an abstract of that article. This is the coronavirus CGI representation. Most of these symptoms of coronavirus are nonspecific, and many are common even without COVID-19. These are the post-COVID-19 symptoms that we are discussing. Some of them, though, are of more concern and should be presented to a physician urgently, such as chest pain, shortness of breath, low oxygen level, syncope, vertigo, severe headaches, infection, as they can indicate a more serious problem. Number one is fatigue, the number one most common symptom. Fatigue lingering after the coronavirus, and according to the study conducted by the World Health Organization, the average recovery time for mild coronavirus cases is around 2 weeks, but 3 to 6 weeks for more severe and obviously critical cases. Lingering fatigue may be a sign that your body is still fighting the virus. Muscle aches are the second most common symptom reported in this study. And it's not necessarily the virus that causes the aches, but your body's immune reaction to the virus invasion. Again, a nonspecific symptom, that is muscle aches and pains, that occurs commonly with all types of infections. These are also called myalgias. Shortness of breath was the third most common symptom reported in post-COVID-19 illness. And shortness of breath or difficulty breathing was a long-lasting coronavirus symptom. This is a symptom on its own or with others that should be investigated by a physician. It should be reevaluated also if it is getting worse. So initial evaluation, getting worse, go to the clinic, go see your physician. Lack of concentration was the number 4 most common symptom. And again, 40% of the patients in this study and analyzed experienced confusion and consciousness disturbance, and lack of concentration is included in this. This is commonly referred to as the, quote, brain fog, unquote, and many patients express feeling this way while recovering from coronavirus. This is another potentially worrisome symptom in that it can indicate a more severe case. Fifth most common symptom is inability to exercise. After recovering from COVID-19, some patients find it hard to exercise or to be active, even if they were physically fit before contracting the virus. Again, this may be due to some of the other symptoms we will discuss, including shortness of breath, fatigue, lack of energy, etc., that are common with and following the coronavirus infection. Sixth most common was headaches. Headache is a long-lasting symptom after coronavirus COVID-19. This may be due to dehydration, congestion, or other symptoms of coronavirus such as fever, but it also can be a serious symptom indicative of more extensive or other diseases being present. For example, encephalitis is a common manifestation after coronavirus with severe headache. Insomnia was number 7 in the order of symptoms. And the lack of sleep may be due to anxiety or worry about the virus, or may be attributed to other lingering symptoms such as muscle pain, myalgias, aches and pains, shortness of breath, and cough can prevent people from sleeping as well. So this is a non-specific symptom, could be due to a lot of similar problems. The 8th most common was anxiety. This symptom again may be non-specific, but there are cases where it is more serious, indicating that the virus has affected the brain, such as in encephalopathy, especially if a neurological symptom is associated with anosmia, which is the lack of sense of smell. One should consider possible encephalitis from the virus. 9th most common was memory problems. Since the virus affects the nervous system, memory problems may be a lingering side effect for some patients, especially those who have suffered severe cases. It can also be a nonspecific symptom from being ill, but should improve with time in those cases. So if the symptom continues for a prolonged period of time, please see your physician or clinic and get an evaluation for this symptom. The 10th most common symptom of post-COVID-19 is dizziness. Dizziness may be due to decreased oxygen levels, dehydration, fevers, or headaches, also caused by the virus. This is more serious and should be evaluated by the physician. The symptom not only indicates the severity of the illness, but is also dangerous in that patients can then fall, or they're prone to falls and prone to injuries as well. So again, see your physician, go to your clinic, and get evaluated. The 11th most common symptom was chest pain or chest pressure. Pleurisy is a sign of pneumonia or another type of infection and can be caused by COVID-19. So recovered COVID-19 patients should see a doctor if this patient symptom persists. Obviously, this should be evaluated immediately by a physician for new onset chest pain. Many of the patients with this symptom have been shown on CT scans of the chest to actually have infiltrates, pneumonitis, which could lead to fibrosis. Next most common symptom, number 12, is cough. The cough associated with COVID-19 may take a long time to go away because your body is attempting to get rid of lingering mucus and phlegm. Also, many of the patients with this symptom had infiltrates on CAT scan of the chest, indicating a potentially more serious condition than just a cough would suggest. So again, lingering cough may be a sign to see your physician for a reevaluation. Number 13, most common symptom was joint pain, arthralgias and myalgias. The immune response may still be heightened in those recovering patients, causing this joint pain to last. This is also associated with the other symptoms of myalgia, aches and pains, and if progressive can lead to more disability. So it should be seen by a physician if it is lingering or increasing in severity, or especially associated with swelling, redness of the joint. Heart palpitations are number 15 most common symptom of post-COVID-19. Ongoing heart issues such as palpitations may be long-lasting for COVID-19 patients regardless of their illness severity. Therefore, this is a symptom that must be evaluated by the physician as it portends possibly more serious consequences. So a visit to your local emergency department, your local clinic, or private physician is recommended for this symptom. Symptom number 15, most frequent, is diarrhea. Diarrhea lasted an average of 14 days for COVID-19 patients in this study. This may also be a big factor in the spread of the disease due to contact in restrooms and with improper disinfection. The virus is found in the stool and in other body fluids. And again, the stool was a common source of infection with contact between patients. Again, thank you for your support. Again, thank you for your support again. Thank you for your support. Please comment. Again, this study was first published in ResearchGate in 2020 during the COVID-19 pandemic. Dr. Gary Joseph Ordog, MD. To see a continuation of this series all the way to 100, please press on the button to continue. If you enjoyed this video, there are more extensive versions of 30, 50, and the 100 most common symptoms of post-COVID-19. Press my channel subscribe button to continue.